Well, look, I'm really pleased that the BMA have responded to my offer to sit down and talk to try and avert these strikes. I'm very clear we can't go further on pay. We've already given them a 28.9% pay increase, and they've had the largest pay award of the entire public sector this year. So offering more would be unaffordable, but also unfair to other NHS staff and other public sector workers. But there's plenty of stuff we can do and want to work on together that would improve the lives of resident doctors, improve the service for patients, and give everyone a win-win out of this situation. So that's what I'm looking to achieve.
But if you say you're not willing to budge on pay and they say it's about pay, then surely the process is not going to work.
Well, what I want the BMA to recognise is that their whole dispute has been about pay. That's why the government has moved and given them a 28.9% pay increase. They can't just dismiss that or forget that. That's come at considerable cost to the taxpayer. And also, it's the highest pay award in the entire public sector. So we've got to be fair to other staff in the NHS and beyond. But there's still lots of things we can do and want to do together to improve the conditions that resident doctors are working under, to improve their career progression, which would be the best pay rise possible, being promoted to become the consultants and the GPs of the future. We will look at those issues with them. So I'm pleased they've responded to the offer of talks to avert strike actions. I hope this can lead to a situation where everyone wins. If strikes go ahead, everyone loses. Doctors lose, the NHS loses, patients lose, and the public lose. And that's not a situation I think the majority of resident doctors want to find themselves in, which is why they didn't support the strike action in the first place.
Will you be discussing at all any sort of longer-term pay progressions for resident doctors in these talks?
Well, we've been really clear that what we can't do is reopen this year's pay award. It's the most generous of the entire public sector, and they've had 28.9% out of the government so far. So I think it's unreasonable to press for more at this stage, and that's why these strikes are unnecessary. What we can do is look to improve the conditions that resident doctors are working under, to look at their longer-term career progression, and also to look to the future more generally. That's the conversation that we want to have. I hope it will lead to everyone being able to walk away with real progress and a situation where everyone wins. If these strikes go ahead, that's a scenario in which everyone loses, and I think that's why a majority of resident doctors didn't support this strike action.